I don't know if I can.
Good morning, everybody, and welcome to the APDA Minnesota Summer Educational Event, Planning for the Future as Parkinson's Progresses. My name is Anushka Shiell, and I am the Information and Referral Coordinator at the American Parkinson's Disease Association Minnesota chapter. Thank you so much for joining us today. And after some brief announcements, we will move right into the presentation. Please feel free to type your questions into the Q&A section in Zoom, and questions will be addressed at the end of the presentation. APDA Minnesota chapter is part of the largest grassroots network dedicated to fighting Parkinson's disease. We work tirelessly to assist the more than 1 million people with Parkinson's disease in the United States in living life to the fullest. We offer a variety of services in the state of Minnesota, and you can visit our website in order to explore all that we have to offer. Our website also hosts a vast array of publications, webinars, articles, and information that can help you understand Parkinson's disease. And if you're joining us from another state, we have chapters and locations throughout the United States, and you can find that contact information on our website as well. APDA Minnesota is available through our helpline, our email address, as well as our social media outlets. So with that, we will get into our presentation for the day. This presentation will focus on issues including planning for the future, advanced healthcare directives, community resources, home modifications, if or when to transition to care outside of the home, and end-of-life issues. Again, please feel free to type your questions into the Q&A section in Zoom, and we will do Q&A at the end. Taking the time to make plans and advanced preparations can help ease the transition as Parkinson's disease progresses. Some families find it beneficial to hold a family meeting every year to talk about caregiving roles, any changes to caregiving roles or added support, and plan for the future, such as designating your healthcare power of attorney, which can be a spouse or an adult child, another member of the family, or a trusted friend. Making sure financial and legal matters are in order can also ensure peace of mind for the people with Parkinson's and other members of their family. And some of these financial and legal matters include wills, trusts, insurance policies, deeds, powers of attorney, estate planning documents, lists of assets and beneficiaries, and so on. Whenever any changes occur for the person with Parkinson's as Parkinson's progresses, whether that's changes in medical health status, cognitive changes, or mental health, it's important to consult with the movement disorder specialist or neurologist, because those changes are important for the provider to know about as well to plan for future treatment and quality of life. So some basic tips around organization planning that you may already have in place. It can be helpful to keep a notebook listing medication schedules and daily routines in case the primary caregiver is ill or needs to travel out of town. Posting emergency numbers in a central location of the house, like numbers of other family members or friends that might need to be notified in case of an emergency, can also be helpful. And also making sure you understand your insurance benefits and covered services, and learning what long-term care coverage options and long-term care options in general are available. Keeping important legal and financial documents in one location for safekeeping and easy access can be helpful. Some common options are a locked fireproof box or a safety deposit box, and you can share this location with a trusted family member or friend. It can be really, really great to consult with a social worker to learn about resources, programs, and services, and care options as well, appropriate for both current needs and future needs. And you can ask your doctor for a referral to a social worker. They can place a referral for you. So advanced healthcare directives are legal documents that specify the person with Parkinson's wishes for medical decisions and treatments. And questions include whether to initiate or continue CPR, life-saving measures such as mechanical ventilation, and other considerations like artificial feeding. And you can seek information from your healthcare provider or a social worker for help with your advanced healthcare directive if you do not already have one in place. It's also important to create a will that clearly outlines your wishes, and you can seek legal advice to ensure that the document is valid. And when in doubt with any kind of financial or legal planning, consider consulting with an elder law attorney. These attorneys focus on the special needs of seniors, and their expertise is really targeted at protecting the autonomy, the quality of life, and the financial security of seniors as they age. You can find elder law attorneys by getting a recommendation or a referral from your family or friends. That can be a really good way to find someone that has, been trustworthy from people in your life. You can also visit the National Academy of Elder Law Attorneys website for help finding an elder law attorney in your area. They have information about elder law attorneys all throughout the country. I have the link right here on the slide if you would like to keep that in mind for future reference. So we'll talk briefly about long-term care insurance as well. Long-term care insurance can be a really helpful tool. It provides funds to hire assistants like a home health worker with activities of daily living, such as bathing, eating, dressing, or so on. And a good long-term care insurance policy will provide benefits anywhere, whether you are living at home and would like in-home care, or assisted living, a nursing home, or a hospice facility. So it should cover benefits wherever you live. However, evidence of good health is required for purchase. And if you already have a diagnosis of Parkinson's or even another pre-existing condition, you may not be able to purchase long-term care insurance. The link on the slide offers a really comprehensive and thorough frequently asked questions page about long-term care insurance specific to the state of Minnesota. So I do recommend checking out that page if you have detailed questions about long-term care insurance in Minnesota. If you're watching this presentation from outside of Minnesota, your local state government page should have a similar explanation of long-term care frequently asked questions. And if you don't want to write down this entire link, you can find it by searching long-term care basics in whatever state you live in on Google or another search engine. If you do have long-term care insurance and you have Parkinson's disease, review your insurance policy in detail. Check to see whether your policy is in good standing, whether you have to continue to make premium payments, if there are options in the policy that could affect coverage, and what the triggers are for collecting on your policy. Because typically long-term care insurance policies are triggered by a need of assistance of some significant level. And policies will begin paying for care according to the terms of the contract, and this will vary by the contract that you signed. In some cases, occasional help at home to assist with activities of daily living is enough to trigger payments. The trigger could also be the need for regular in-home care, like daily daily visits from a home healthcare worker, or medical certification for the need of nursing home care. So long-term care insurance policies are usually capped at a contractual dollar amount, or perhaps for a certain length of time, and they will pay up to the limits of your policy, or for that length of defined time, like 1 year, 2 years, or so on. So family, friends, faith communities, and neighbors may reach out to ask what they can do to provide help. And it can be really helpful to create contingency plans for who exactly in your life you can call on in case the caregiver has an urgent errand that needs to be addressed, in case the caregiver needs to travel out of town due to an emergency, in case you need some home maintenance or repair, in case the caregiver becomes ill, or the person with Parkinson's becomes ill, or both of you become ill. So having those detailed contingency plans for who exactly to call on and what kind of support they can provide during a crisis can really save some stress during the time when this help may be needed. Community resources and supportive services can also be extremely helpful for people with Parkinson's and their family members. Respite care, help at home services, adult day programs, grocery delivery services, or meal delivery services, as well as transportation assistance are all options for people with Parkinson's and their family to turn to. And the APDA Minnesota chapter provides $400 grants or patient aid scholarships for people with Parkinson's to use for respite care, help at home, adult day programs, medication assistance, transportation assistance, Parkinson's exercise classes, home modifications, and adaptive equipment. So if you'd like to learn more about this program, you can call the APDA Minnesota Information and Referral Center at 651-241-8297 to receive a patient aid scholarship program application. And you can also find that patient aid scholarship information on our website. You can also call the APDA Minnesota Information and Referral Center at this phone number anytime you're looking to get connected with the above community resources or supportive services and would like information. For example, if you live in Rochester and you're interested in learning more about meal delivery services for seniors, you can give me a call. I'd be happy to get you the names of some meal delivery services that you can reach out to. And if you live outside of Minnesota, you can call your local APDA Minnesota Information Referral Center in your state, and they would be happy to connect you with their own patient aid scholarship and their own referrals to local community resources. So do not hesitate to reach out if you're interested in learning more. We can help you navigate this system of community resources. So various companies provide in-home help at home and or respite care. So locally in Minnesota, there's companies like Visiting Angels, Home Instead Senior Care, Right at Home in-home care and assistance, Synergy Home Care, and Comfort Keepers, just to name a few. And all of these companies provide workers that can come into your home to help with various tasks around caregiving, or simply to provide respite care so that the caregiver can go out and perform any sort of activity while the person with Parkinson's has some company at home. So the range of services that they provide include, again, basic companionship and respite care, meal preparation, light housekeeping and household chores, medication reminders and assistance, grocery shopping and other shopping, and help running errands. So one first step, if you're interested in incorporating some of these services into your daily life, is to think about the tasks that you need help performing, and to consider the amount and type of support you need. Some people may need help performing errands and chores outside of the home. Some people might find it helpful to have some assistance for personal care tasks like bathing and grooming. And again, there's a whole spectrum of care needs and supportive services. You might need someone to just come, once or twice a week to help with errands, or you may need someone to come every day. And so just think about, again, those tasks that you need help performing and how much support you need and what type of support you need. Care needs can change as well as Parkinson's progresses. At first, you might just need someone to help pick up groceries for you every now and then, or pick up your prescriptions at the pharmacy. But as Parkinson's progresses, those care needs might evolve to include a home health aide coming every day for a couple of hours at a time, or overnight support, or maybe even full-time if necessary. And the best time to investigate in-home care options through the various organizations is before these options are needed. Because, that just gives you time to find the right fit for you in terms of what agency you're working with, what provider you're working with. You want to find the right individual who's a good fit for your family. And it can also help you have some extra time to figure out, the pricing options as well. So I really recommend looking into doing some preliminary investigation or looking into in-home care options well before these options are needed. And a lot of these agencies will do a consultation with you over the phone to help you figure out, what the best plan is for you based on your current and future needs. The person or agency that you hire should understand Parkinson's symptoms and how to help someone with Parkinson's disease. And that's something to talk about when you do make that initial contact with the agency to ensure that whatever worker or workers that they're sending out is familiar with Parkinson's disease. So as you're at the stage where you're thinking about a paid caregiver, if that's something you'd like to incorporate, again, it can be wise to define the care and support needs. Do you need someone to help the person with bathing or respite care a couple times a week? Do you need someone available during the nights? Develop a care plan and a checklist. Include a clear list of household tasks, personal care tasks, home maintenance tasks, and just any activity that the paid caregiver or home health worker will be expected to do, so that they're really doing everything that they can to help you and be most helpful to you, the caregiver, in this situation. So all of the needs for them to do around the house, whether that's, helping with grooming or dressing or, grocery shopping, etc., all of those needs and the steps that will be taken to address those needs should be written down. You can write it down and you can have the care worker and the agency review that list as well. And just so that everyone can easily understand, what the expectations are. And, maybe post that list somewhere in the house, maybe in a binder or document that you leave in the kitchen, maybe in a list that you kind of post to the front of the refrigerator, depending on how detailed that list is, so that if you, the caregiver, are out of the house while they are providing that support, they can consult that list and they can know exactly what the expectations are and what they should be doing for you while they're in the home. So there is a sample worksheet for paid caregivers who are providing respite care or other home health care to a person with Parkinson's or other needs. And you can fill out the sample worksheet to help the care worker get a really clear understanding of the person with Parkinson's needs. And the both of you can fill this out together. Like, what time does the person usually wake up? What time do they go to bed? Are there any food allergies or other allergies to be mindful of? If the home health person is assisting in meal preparation or, providing some snacks during the day, Are there any dietary restrictions? Are there certain considerations to be aware of when they're providing food, such as the need for smooth food that's easy to swallow, even, favorite foods, likes and dislikes? Are there special adaptations that the home health worker should be aware of, like adaptations used for eating or dressing or personal care, like assistive devices that would help with any of that to make it easier? And then just some general information, like what are hobbies and interests? Would you enjoy going for a walk around the neighborhood with your home health worker? Would you find it beneficial to have them take you to an exercise class at the YMCA? Would you like them to drive you to the library? And information about, what the typical daily routine is, meal times, times for activities in case there are social events or other things that they can help transport you to, rest periods, exercise, personal care, and other activities. And then just any additional information that the person with Parkinson's would want a care worker to know if they're going to be around them for parts of the day. So another step in kind of orienting a paid caregiver, there's maybe 5 steps you can work through with them as you go through this orientation. You can explain to the worker how to do a certain task, and that can be any task, whether it's a home-related task like doing the laundry, or a personal care-related task around helping the person with Parkinson's with some activities of daily living. So explain how to do the task verbally, and then show the worker how to do the task, really demonstrate it for them so they can see exactly how you do it. You can then kind of step back and observe how they do the task. And, if they're doing it really well, the way you would, you can just let them know that that's exactly how you would like them to handle that task in the future. If you can see that they're doing something differently than you would, and you think it would work better for them to kind of model their behavior over what you're doing, you can point that out too and say, look, I think it would be better if you kind of handle this task in this way. And finally, provide an opportunity to ask questions and make sure that the worker understands your answers completely so that when they perform that task, when you're not around, that they are performing it in a way that you're comfortable with. So more information about orientation before, you formally start services. You can show the worker the physical layout of the home. Where are the supplies needed to do the job, and how to operate any appliances or medical devices. Demonstrate again how tasks should be done. Provide information about household routines, and a lot of that should be covered in the worksheet that you might have filled out for them. Review emergency procedures and whom to contact in case of an emergency, in case you're out of the home. They can reach out to you. If they can't reach out to you, who else in the family, what other friends or relatives can they reach out to? Again, provide information about the person with Parkinson's preferences. It's very important. And have clear instructions about what is not appropriate. For example, having visitors or changing the temperature in the house or smoking in the house, etc. Just, it can be really good to spell that out, say, these are the things that are not appropriate for, for you being here in the home with my loved one. And if the care worker is responsible for grocery shopping or picking up medications or anything like that, have a clear procedure for keeping track of the cash that you give them and what they spend if that worker is responsible for any activities that require cash. And also just have a plan, a clear plan, ideally written in place for the worker for how to prevent or respond to potential problems. Like, for example, wandering. If the person with Parkinson's, may try to wander, how should the care worker address that and maybe redirect to a different activity? And then again, information about what the person enjoys doing, and also what he or she is able to do independently, what they don't need help with, because everything that they can do independently, they should do independently. And overall, it's just really helping the paid caregiver get to know the person with Parkinson's. They should understand the person's history, their personality, their preferences, their hobbies, likes, dislikes, and daily routines, because the more that they have an understanding of the person with Parkinson's as an individual, the better that relationship can be between the paid caregiver and the person with Parkinson's who they're spending their time with. So moving on to another helpful resource that can really kind of free up some time and energy for the person with Parkinson's and also their care partner, grocery delivery. It can, again, free up time and effort, and Shipt, Instacart, and Coburn's Delivers are some local, and also I believe Shipt and Instacart are available throughout the country. They can offer grocery delivery either same day or next day. I have included their websites here on the slides if you'd like to look that up. For people local to Minnesota, Cub Foods also offers same day or next day grocery delivery. Target offers grocery deliveries. Some of these organizations offer free grocery delivery. Others have a small charge associated with grocery delivery. So I do encourage you to look that up if that's something that would be helpful to you. I know especially during the time of the pandemic, a lot of people with Parkinson's and their family members were utilizing grocery delivery to help keep them safe at home during the pandemic. And it is a convenience that can be extended to, throughout the year as well, in case that frees up time and energy. So we're going to move on to some special considerations at home in your physical living space, because as Parkinson's progresses, it may be necessary to make some changes to your home and consider the environment to make sure that the environment is safe and supportive to maximum mobility and independence. Because as Parkinson's progresses, there may be some mobility changes and challenges between things like freezing or shuffling of gait in terms of motor symptoms, or generally maybe the transition to using certain mobility aids like canes, walkers, or wheelchairs. If that is the case, that is all the more reason to make sure that the home is safe for people using mobility aids. And a basic first step is just to reorganize and remove clutter, keeping the floors clean and free, removing any fall hazards or trip hazards, and keeping things that you use often in a convenient location that's easy to reach and access for the person with Parkinson's. Something to consider is, if the person with Parkinson's currently uses a walker or a cane or a wheelchair, or if they may need that in the future, will a ramp be needed for outside access into the home? Or indoors, do the floor surfaces easily accommodate mobility aids? Are the bedrooms and the bathrooms accessible for wheelchairs and walkers? And a really good tool that you can consider is having an occupational therapist perform a home assessment. So occupational therapists can come out to your home, they can provide an assessment of your home and make suggestions about accessibility and safety considerations. You can ask your provider, your doctor, for a referral to an occupational therapist, and you can discuss this with your occupational therapist to see if they are able to come out and do an assessment of your home. And there are a whole range of home adaptations for people with Parkinson's, and not all of these may be necessary. And some of these range from small changes that you can even, make fairly easily to major building changes requiring construction. And, the range of adaptations to the home may include adding rails for support, lowering countertops, or adding hooks to the kitchen walls to store mugs or pots or pans in an easy to reach place rather than opening cabinets. Some people create half steps to make large steps smaller. Again, installing ramps, widening doorways in case of accommodating a wheelchair. Some people remove or level threshold strips between rooms to just make it easier to move from room to room. Adding stair lifts if you're in a multi-story house, or replacing a bath with a walk-in shower. And specifically around the bathroom, I'm sure you may have heard the statistic that a lot of falls happen in bathrooms. So anything that you can do to ensure that your bathroom is safe is incredibly important. You can place a tub transfer bench, add shower chairs in case standing for the length of a shower is fatiguing, mount bars or handrails near the entrance to the shower, near the toilet, etc., to make sure that there's some grip support for someone to use while they're moving around. An easy modification for safety is to place non-skid bath mats around your bath and shower. Another relatively easy modification is to install a raised toilet seat. And also switching out faucets can be a modification to consider. Instead of a bathroom faucet that you need to turn to get the water, there are touch faucets where you can simply, they're motion activated. You can just wave your hand and the water comes on, so you don't have to fiddle with a touch faucet, which can be difficult with tremor or stiffness. Around the bedroom, inserting chair or bed risers could be helpful, or adding a handle or a bed rail for help getting out of bed if necessary. And in general, open pathways for rooms are important if the person is using a mobility aid. And it's also important to consider removing obstacles like floor rugs. Floor rugs can be difficult to walk on, and they can provide a fall risk for people with Parkinson's due to shuffling gait. If you do have any floor rugs in the house, you could tack them down to make sure that they don't wrinkle and provide a fall risk. And if there is bare flooring that's being cleaned, you can clean it with non-skid floor wax to make sure that any mobility aids like walkers aren't skidding on that bare floor. So standing lamps or table lamps should just be placed in such a way where they're not in the way, and also that they can't be easily tipped over if someone accidentally hits it with a walker. You don't want the lamp toppling over onto the person. So maybe just positioning them in corners of the room where they're kind of out of the way of getting run into. And if the person ever does, use a wheelchair, furniture can be placed far apart to enable a wheelchair to have access in or around rooms in a house. A good rule of thumb is that furniture items can be placed around 5.5 feet from each other, because that is the amount of space that allows most wheelchairs to do a complete 360-degree turn. So again, these are not all home modifications that you need to rush out and do immediately. Again, some people may not even need these modifications, but it's just something to think about if you do plan on staying in your home over the course of Parkinson's disease. But care needs may grow possibly as Parkinson's progresses. And in some cases, the day may come where a certain level of care cannot be provided at home. And in that case, it may be time to transition to a different or more supportive living environment. And home care is possible under certain circumstances. The designated primary caregivers should have few other responsibilities not related to the person with Parkinson's. And what I mean by that is that if the caregiver has a full-time job, it can be difficult to provide comprehensive home care. And again, the house should be set up in a way that it comfortably accommodates the needs of the person with Parkinson's. There should be space for a walker or a wheelchair or other medical equipment. If the house is on 2 floors, maybe there can be a way to set up a bedroom on the lower floor. And again, the home environment should just be safe and supportive of maximum independence. And arrangements can be made, whether from the primary caregiver, as well as help from a home health agency or other family members or friends, to provide companionship, medication, meals, personal care help, transportation, and to and from doctor's appointments and therapy visits, and home maintenance. So if those arrangements can be made, that is great. And, you know, with the physical home environment, are there the necessary structural changes such as ramps or handrails, bathroom alterations, etc.? If those have all been made, as well as those other arrangements for around, you know, actual providing of care, then staying at home and kind of aging in place with Parkinson's disease as it progresses is definitely possible. Home care may not be an option if financial circumstances do not provide it, such as if the primary caregiver must maintain like full-time employment. If the caregiver's physical and emotional strength is depleted and they really need some additional support, home care may not be an option if the person's condition requires skilled nursing care or really around the clock attention, because the caregiver should be able to get sleep and, you know, look after their own health as well. Home care may not be an option if the person is a 2-person assist, which means that it is necessary for 2 people to assist with safely transferring them in and out of bed or out of a chair, etc. Or again, if the physical layout of the home is just unsuitable for someone using a mobility aid. So if you are thinking over transitioning to out-of-home care, it's a really good idea to visit at least a few facilities before a transition is necessary. This helps you get an idea of the available choices out there in your community. You might visit some and say, okay, this is a place that I really feel comfortable with living in the future. And you may visit some and just be able to rule them out immediately and say, okay, we can take this off the list. This is not a place I'd be comfortable with. In any case, visiting facilities ahead of time lets you narrow your choices down, and it gives you time to make the decision. A lot of facilities also have waiting lists. So maybe you can get on a waiting list and see, you know, you can revisit that whether, you know, a year from now or so on. Overall, you know, thinking about this, visiting facilities, maybe even getting on a waiting list is much less stressful than starting cold following a hospital stay or another kind of crisis situation, especially with regards to waiting lists, because some of these waiting lists can be quite long. And if you are already on a list, you know, that could be helpful in case of an emergency situation. So there are a lot of options for out-of-home care, and we'll go over some of those options. Assisted living facilities are, you know, really common options. They provide, you know, obviously an actual apartment for rent, so a living space, as well as, you know, meals, housekeeping. They also provide supervision and assistance with care as needed. So it's designed for situations where independent living may not be something that you want or need, but neither do you need 24-hour intensive nursing home care. So the fees for care on top of rent vary by facility. And when you call or visit these facilities, you will want to ask about what are those fees for extra care. Because, you know, they do have caregivers on site who can help with, you know, activities of daily living. They can help with your medication management, with your bathing, grooming, dressing, etc. But fees for those cares are on top of the rent you pay. So you want to be very clear about the financial implications of what kind of care choices you make. So the caregivers at assisted living places are, they're nurses or trained certified aides who can, again, assist with tasks like bathing, dressing, escort to meals, medication setup and dispensing, and routine checks on you as well, just checking in to make sure that everything is okay. And assisted living facilities, another perk is that they also provide housekeeping, meals, so you don't have to worry about meal preparation. There's 3 meals a day, usually snacks as well. And they also provide social programs, which can be really just a nice way to stay socially connected and active during the day. A lot of assisted living facilities provide exercise classes on site, and many have gyms on site as well that you can use. And some facilities may also offer rehab therapies, like visiting PT, OT, or speech. They may offer other specialized care for Parkinson's. They may offer hospice care. It really depends. And again, just ask about this when you visit. I know that there are, especially around the Twin Cities, there are several Parkinson's certified assisted living facilities that offer some really good Parkinson's specific services. So that is something to inquire about when you are reaching out regarding assisted living. And something that you may see as well when you do your search into assisted living and other services, they're called like a continuum of care. They may have independent living apartments on the same site as assisted living, on the same site as memory care, so that, the idea is that as a couple or as an individual kind of ages, they can move into the living environment that is most supportive and most helpful for them. So that's something to keep in mind as well. So nursing homes are another option. These are facilities that are licensed and regulated by state and federal governments to provide really skilled care 24 hours a day. So if care needs are quite advanced or considerable, a nursing home can provide that 24-hour care. RNs are on duty at nursing homes 24 hours, and certified nursing aides as well. And physicians are generally the directors of skilled care facilities or nursing homes like this. And again, you can ask the nursing home administration when you are doing a tour, what is their level of experience and expertise in providing care to people with Parkinson's? Are they familiar with the specific care needs of people with Parkinson's around medication management? Have they provided care to people with Parkinson's in the past? So don't hesitate to ask questions whenever you're about to inquire about a service, about not just their services, but specifically their level of expertise and comfort around services for people with Parkinson's disease and their unique needs. I know that the Struthers Parkinson's Care Network locally in Minnesota, they provide training to assisted living homes, nursing homes, et cetera, to make sure that staff at those homes are familiar with the unique Parkinson's needs. So ask about whether that facility, whether it's assisted living or nursing home, ask if they're part of the Struthers Parkinson's Care Network and whether they've received training through Struthers. So we'll move on now to a discussion of palliative care. And palliative care is defined as patient and family-centered care that optimizes quality of life by anticipating, preventing, and treating suffering or pain. It is very comprehensive. It offers care of physical, emotional, social, and spiritual needs of the individual who needs palliative care, as well as their family members and caregivers. It really stresses patient autonomy and access to information and choice. And you can receive palliative care in the hospital, at outpatient clinics, in your home, in the community where you reside, in assisted living, and so on. So you can really receive it in any setting. Palliative care is usually provided by a team of professionals that may include the doctor, nurse, social worker, chaplain, a pharmacist, a nutritionist, a counselor, and maybe others as well. And most insurance plans cover all or part of the palliative care treatment cost. And this whole palliative care team can really help the person who is affected and their family make the best informed decisions about treatment options. They can talk through treatment options, medication options, and so on with you in detail and help you navigate that decision-making process together. And if it is necessary or if it's desired, palliative care can also segue into hospice care. And we'll talk a little bit about hospice care as well. Hospice care is available to anybody with a limited life expectancy, usually your medical provider, your movement disorder specialist, or neurologist can indicate when hospice care may be appropriate. Hospice care emphasizes comfort care over aggressive treatment and interventions. Really, quality rather than quantity of life is what is stressed. And the caregiver's concerns and emotional needs are taken into consideration too. And again, emotional, spiritual, and practical support is provided based on the individual's needs and the family's needs. And something to emphasize is that professional medical care continues throughout. Hospice is not giving up on life, and hospice is not withdrawing care. You have professional medical care throughout this process. Again, a physician referral is required for hospice care, which again, it can take place just like palliative care in your home, in assisted living, in a nursing home, or so on. Check to see if it's covered by your insurance. It is covered by Medicare. So again, just to clarify and emphasize that hospice is not giving up on life. It's not withdrawing care. It is an approach to treatment that recognizes death as the natural ending to life, and it provides a person the maximum amount of autonomy and dignity, as well as comfort during that end of life process. You can receive hospice services wherever you reside to make sure that you're comfortable during this time. And I'm sure you've heard this before from many, many people and providers, but Parkinson's is, it's chronic, it's a progressive disease, and the course of Parkinson's is so highly individualized. No two people with Parkinson's are going to have the same experience. And it can be difficult to determine when the end of life is near. And hospice may be appropriate if a person is going through advanced dementia, recurrent episodes of pneumonia, significant weight loss, if there is an inability to eat or drink, if there are recurrent infections or significant pain. If this is the case, it could be appropriate to talk about hospice with your provider. So we'll move into a discussion of end of life decisions. The first thing I want to discuss is the POLST form. You may have heard of this form before. It stands for Physician Orders for Life-Sustaining Treatment, and it is for people with serious illness or frailty where it's possible that they could pass away within the year. And the POLST form is used in addition to the healthcare power of attorney. It's really meant to assure the person affected, as well as their family, that the healthcare professionals on their team will provide only the treatments that the person wishes to receive. And the POLST form acts as standing medical orders. It applies to all healthcare personnel, like EMTs, emergency room personnel, and in all settings, whether that's your home, your assisted living, your nursing home, etc. And this POLST form is completed after a careful decision between the affected individual, the caregiver or family member, and the doctor. They can really guide you through this process, and your provider can give you more information about this. A lot of people, when they fill out the POLST form, they have it on file on their medical records. I've spoken to some people who actually have a copy of the POLST form at home too. So those are some options. Regarding the do not resuscitate order, there can be a discussion with the person affected, with the caregiver, and with the provider too about what should be done in the event of a life-threatening emergency. And a DNR order means that no life-saving techniques will occur in the event of a loss of heartbeat or breathing. So it isn't enough to kind of say to your loved one or a caregiver that, oh, I don't want to be resuscitated if that happens to me. These wishes must be clearly declared to your physician, and there needs to be signed documentation of that DNR order. It should be part of your advanced directives if you choose to have one, and it should be on file with all healthcare providers who are likely to provide care for the person. So again, keep it on your medical records. And I've, again, spoken to some people that have a copy that they carry, in their wallet, or they carry it, they have stored it somewhere in their home. So a copy of this DNR order, if you choose to have one, it must be shown to emergency personnel if there is a crisis. Some people have a living will, but a living will alone is often not enough to ensure that a DNR order is carried out. You do need to have that documentation for that order. So again, that's something to discuss, and it is an option if that is something that you would like to have in place. So I talked about the POLST form a couple of minutes ago, and there are 3 sections on the POLST form: CPR, medical interventions, and artificially administered nutrition and hydration. So it's important to discuss with your provider and with your caregiver and family whether or not artificial nutrition and hydration should be used if swallowing problems and/or advanced dementia keep a person from eating and drinking normally. Because without a discussion on this, a crisis situation can develop, and if the person affected is unable to make their wishes known at that time, it's left to the healthcare power of attorney to decide whether or not to have that artificial nutrition and hydration system put in place. That can be a really difficult and painful emotional decision, and it's really good to have the person affected make that choice for themselves, so that that choice doesn't have to be made by a loved one. So again, a question is the person able to make decisions at the time of the intervention? And ideally, you would have discussed this ahead of time. And if the person is able to make that decision, the question of whether or not to accept artificial feeding can be made on your individual circumstances or beliefs. It's a really personal decision. It's up to you and your provider to talk more about this. The person affected has choices. You can choose no artificial nutrition, a defined trial period of artificial nutrition, maybe 2 weeks or 2 months, or long-term artificial nutrition by tube feeding. Again, I can't stress enough, it's ideal to have this discussion with your healthcare power of attorney ahead of time in case you are or become unable to make decisions at the time and make those wishes clear. If those choices aren't already in place, the person acting as the health decision surrogate may not have time to think about it in the moment. And I do recommend talk to your neurologist or your movement disorder specialist to learn more about the risks and the quality of life associated with artificial nutrition and hydration. They can provide a lot of detailed information about this, and you can consider whether this is an option that you would like to put in place for yourself. So we have covered a lot of ground actually in the past hour or so. There are a lot of different topics to consider with planning for the future as Parkinson's progresses, whether that is things like home modifications or bringing in paid caregivers, maybe considering a move out of the home, and just legal and healthcare decisions as well. So it's really important for people to seek support by attending support groups, sharing your experiences, and making connections with others who are living with Parkinson's. There is a lot to learn from each other as you navigate this journey of Parkinson's progression, and you are not alone. There are so many people who are, living with Parkinson's and are able to share their experiences with you. So I really encourage you moving forward to visit apdaparkinson.org for information and support. There is a wealth of information online about Parkinson's disease, including, how to navigate as Parkinson's disease progresses. And again, please don't hesitate to call the APDA Minnesota Information and Referral Center. Our number is 651-241-8297. If you have any questions at all about any of these things, like, whether you're looking for an assisted living in your area, whether you're looking for a home healthcare agency, or you want to learn more about finding an elder law attorney near you, whatever your question is, don't hesitate to reach out. There are APDA, we're always here for you. We want to help and support you. So with that, I will actually open up to questions. If anyone has any questions at this time, I would be happy to address them. So I'm going to check the Q&A section, and I don't see any questions at this time. If you do have any questions, again, please type them into the Q&A box and I would be happy to address your questions. And if you can't think of any questions right now, or if you have questions in the future, you can definitely call or email and connect with us in that way. And, we're always here for you. As I wait for questions to come in, I just want to share some information. I did have a question asking if the presentation was saved for future access. Yes, we have recorded this presentation and we will post it on our APDA Minnesota website. So we will be sending out an email after today's program, and the email will include, a link to this recording so that you can reference the presentation in the future. And I'm also happy to share my slides as well. So I will attach the slides to the presentation for your reference in case you'd like to note down any phone numbers or any of the links. So you can access this presentation again. Let's see. Great. I see. What is the difference between the pulsed and the MOLST forms? And I believe that it is the same form. I believe it's the same form, and it's just a difference in terminology. So if you do have a pulsed form, I recommend next time you go into your provider, ask if that is the same thing as the MOLST form. I believe that's the same. It's the same thing. It covers the same thing as well. So someone asked about looking for resources for clothing that is easy to get on and off. And I actually do have some resources. There are some clothing websites that actually specialize in clothing that is easy to get on and off. So clothing with like Velcro and not buttons and zippers that can be hard to put on and off for people with Parkinson's. I I don't have that website written down right now to share with you, but I really encourage you to give me a call or shoot me an email. I will send you that website for clothing that is easy to get on and off. And something else too, this is another option. If you have just existing clothing that you really like and you would like to have modified with like Velcro tabs for easy pull, you can take that clothing to a tailor, and most tailors will be happy to kind of replace buttons or zippers with Velcro and other easy access. So you can buy specialized clothing, but sometimes, you know, if there is cost, if there are cost obstacles to getting special clothing, you can have existing clothing altered by a tailor to make it easier. So again, call me directly because I don't have those websites in front of me right now, but I have connected people to those resources before. I see a question about tax considerations. I don't know if that's tax considerations around long-term care or et cetera, but the best resource for tax considerations, I really recommend consulting with an elder law attorney. They are experts on that. And, you know, even when it comes to questions about how to pay for any of these care options, if you were listening to this and you thought, you know, wow, I would be interested in having a home health person come in, or I would be interested in looking at assisted living, but you just don't have, you know, an idea about how to pay for it, elder law attorneys and social workers can really, really give you a lot of good information about how to pay for these services. Because something that people may not know, if you personally don't have enough money in your own savings to pay out of pocket for home health care or assisted living, there are services through the county available for seniors to get home health care aids coming into your home, or to get money to move into assisted living. So that's eligible through your county, and it's through a waiver system. It's MA, medical assistance for seniors. There's a lot of waivers. There's an elderly waiver is the it's the name of the program. So if you're local in Minnesota, I really recommend look up elderly waiver or look up your county services, because again, if you can't pay out of pocket for in-home healthcare, the county will get that set up for you. They will provide that for you. You just need to meet a certain income threshold, and an elder law attorney can give you details on, you know, what can you do to meet that income threshold, whether you'll need to sell some assets or etc. So again, social worker or elder care attorney. And if you have more specific questions about what exactly those county waivers entail, please call me or email me at the Information and Referral Center, and I can get you information about what services you can get through the county as a senior or a senior with Parkinson's disease. And I can also help get you connected with a worker at your county who can help you navigate this process. I can help you just get connected with your specific county's Health and Human Services Department. So again, don't hesitate to reach out to me if that's something that you're interested in. So those are the questions that I've had so far. I'm gonna share some more information briefly. And if more questions pop up while I'm sharing that information, I will address them. So I wanted to let you all know, that APDA Minnesota is going to have a wonderful in-person optimism walk this September, on September 25th at Roseville Central Park. Some of you may have joined us for the Optimism Walk before. It is a really fun community event for people with Parkinson's, their family members and friends to get together to enjoy, you know, a lot of really great activities. We have cakewalks, silent auctions, we have kids activities like face painting. We have booths available where you can pick up helpful Parkinson's information and information from other helpful community vendors. And it's a really fun event. We did this virtually last year. We're back to in-person this year. We would love to have you join us. And something amazing about this optimism walk is that the patient aid scholarship that I mentioned earlier in today's program that pays for services for people with Parkinson's disease, you know, we have actually given out over $200,000 in funding for people with Parkinson's right here in Minnesota. And this optimism walk is how we get the money to do that. So the more people who, you know, support us at this optimism walk, the more people with Parkinson's we can help. It's a really grassroots project, and it's a great way to support APDA Minnesota and just have a good time out at Roseville Central Park. And if you are interested in signing up for the walk, or you just want to learn more about the walk, you can visit us online, apdaparkinson.org/Minnesota, and you can sign up for the walk. You can email us or you can give us a call to learn more. We would love to see you there. We're really excited to see you all in person again. And honestly, the support from the walk helps us do programs just like this one. So it's really a key event for us, and it's always been a lot of fun. So I also wanted to share information about another program that we're offering on Tuesday, August 17th. It's a therapeutic art program called Connecting Through Art. It's available from 10:30 a.m. to noon. It's going to be on Zoom, so you can join us, you know, no matter where in the state you are. Even if you're located in another state, you can join us. We'd love to have you. You can call me at 651-241-8297 to register. This program is open to people with Parkinson's and their care partner. It's a free program. There's no cost to participate. We have an art instructor who's going to provide a watercolor class to us over video, and then we have a moderator who will guide us through that therapeutic art session. So again, if you're interested in joining, we'd love to have you. And I'm just going to go back to the questions to see if we have any other questions. And somebody has mentioned that they have been diagnosed with PSP instead of Parkinson's disease. Can they still get services? And the answer is for a lot of these services that I mentioned, for the assisted living, for the help at home, the respite care, home modifications, the county services, yes, you can get that. You can get those services, you know, if you have PSP or other Parkinsonism related disorders. So if that is all the questions that we have, I will wrap up, but again, you have my phone number, you have our email address for APDA Minnesota. We're always here for you. Please don't hesitate to reach out in the future. And I just wanted to really thank you. Thank you so much for being at this. Oops, I'm sorry. I scrolled a little bit too fast through my presentation, but really just thank you for joining us today. I really appreciate you taking the time to be here with us. And I just also want to thank our sponsors who made this event possible, Kira Kiran, Amneal, and Acadia. So thank you. I hope you have a wonderful rest of your day. Take care, and I look forward to hearing from you in the future.